As December approaches and temperatures continue to drop, the seasonal change sometimes comes a different kind of depression, seasonal depression. Here to discuss the issue is ELN physician Dr. Ginette Archinal, and so thank you so much for being here
My
today.
pleasure. Thank you.
So what's the cause of seasonal depression?
Well, it's literally what it says. It's a change in the seasons. It doesn't have to be just going into winter and fall. There's actually a variety that occurs in summer as well.
Okay, so it's any seasonal change. 'Cause I always thought it was to do with the weather and the coldness kind of.
It's actually to do with changes in dark and light.
Okay.
Which is why it can be summer for some people as well.
Right, and what are some of the effects that happen based on the seasonal depression? What can people expect if they, what are some of the symptom signs that they're looking for?
It is a true depression, but it's what we call a sort of more lethargic type of depression, so it's almost hibernation, and it is definitely more common in winter, so people feel more tired, difficulty getting out of bed, tend to eat a lot of comfort food, a lot of carbs, that sort of thing.
And I feel like around the holiday season, people sometimes don't even recognize it as depression sometimes. They might just, think, so is there, is it easy to recognize in people, or is it one of those kind of hidden things? Or?
Well, I think people often think it's just the stress of the holidays if we're in the Northern Hemisphere, but generally it's clearly depression, and it has to happen every year. That's the thing. If it happens to you once, it's not seasonal affective disorder. If it happens year after year, you know it is. And one thing that people forget is if your vitamin D is low, which can also happen in winter, that will make you more prone to seasonal affective disorder.
All right. And so what are some of the resources that ELN students can go to if they feel like this is a problem that they're having? What are some of the resources?
Best resource is certainly go to counselling. There are lots of good websites that talk about seasonal affective disorder. Come and see us in Student Health. This is not something that necessarily needs medication. We know that exercising helps seasonal affective disorder. We know that light therapy helps. Get your vitamin D checked.
Right.
There are a lot of things you can actually do that don't involve medication.
Perfect. Well, thank you so much for being with us today.
My pleasure. Thank you for
really
inviting me.
Appreciate it.